Hello, good afternoon, everyone. Welcome to today's health talk. It's been long since I've been into this health talk, so it's good to see all of you back again. So I hope you have a good lunch. So for today, we will be starting a new series, which is Hygiene and Infection Series 1 on how to fight flu and other lung infection. So as usual, if you have any questions along the way, do type in the chat box and we will answer accordingly during the Q&A session, or alternatively during the Q&A session, you can just on your mic and share your questions with us. So today we have Miss Christina and Miss Stella who will be sharing with you about today's health topic. Over to you.
Thank you, Felicia. Good afternoon, everyone. I am Nurse Christina and my colleague, Senior Staff Nurse Stella. Welcome to our sharing of our health talk. So today talk will be Hygiene and Infection Series 1, how to fight flu and other lung infection. So if you have any question, do ask those questions after the presentation during the Q&A. Thank you. Right. So next. So these are our content that we'll be covering for our health talk today. The various medical conditions related to flu and lung infection. How does it affect us? 5-step approach using the acronym FIGHT to fight these infections. Okay, next. So these are few lungs infections that you might know, such as tuberculosis or TB, SARS, COVID-19, MERS-CoV, H1N1, pneumonia, influenza, flu, and cough. Okay, next. So what does this medical term mean? Flu, cold, influenza. So influenza is a viral infection and it attacks your respiratory system such as nose, throat, and lungs. Influenza is commonly called the flu. So influenza, or known as flu, and common cold, both contagious respiratory illnesses but caused by different viruses. Okay, next. Okay, despite having many similar symptoms, the common cold is different from influenza or the flu, is that the flu sufferers' symptoms are more severe. Rhinoviruses or the infection being behind 30 to 50% of the cold. Other viruses that can be cause cold included coronavirus, influenza, and para-influenza viruses. Headache and tiredness affect some of the sufferers. So some of the signs and symptoms of cold are such as nasal blockage and discharge, sneezing, sore throat, coughing, mild fever, which is temperature below 38 degrees. Okay, next. Okay, what is flu or known as influenza? Influenza is caused by the flu virus, which has 3 main types: flu A, flu B, and flu C. Flu A and flu B are responsible for seasonal outbreak and epidemics. Between the two types, flu A causes more severe cases and complications like pneumonia, especially in the elderly, and also young children such as 5 years and below, and those with chronic conditions. The signs and symptoms of flu or influenza, such as flu symptoms usually come suddenly, high fever, which is above 38 degrees, sore throat, coughing, headache, muscle aches, stuffy nose, may have sneezing, nasal discharge, loss of appetite, fatigue, weaknesses, chills, and stomach symptoms. Okay, next. So what is coronaviruses? COVID-19 is the infection disease caused by strains of coronavirus, which is SARS-CoV-2. It was declared a pandemic by the WHO, World Health Organization, in March 2020 and has spread globally. So acute severe respiratory syndrome or SARS, Singapore suffered 33 deaths due to SARS in 2003. So Middle East respiratory syndrome or MERS-CoV, it was first reported in Saudi Arabia in 2012. So coronavirus disease 2019, or known as COVID-19, the first cases were reported in December 2019 in Wuhan, the capital land of China, Hubei province. So signs and symptoms of coronavirus such as most common symptoms are fever, dry cough, tiredness. Less common symptoms such as itches, pain, sore throat, diarrhea, conjunctivitis, which is something like redness in the eye, headache, loss of taste or smell, a rash on the skin, or discoloration of fingers or toes. More serious symptoms such as difficulty in breathing, shortness of breath, chest pain or pressure, loss of speech or movement. Next. So what is pneumonia? Pneumonia can be result from a variety causes of infection such as bacteria, viruses, fungi, or parasites, or chemical and physical injury. Often pneumonia follows an upper respiratory tract infection such as cold or influenza, or known as flu. So outbreak of the new germ like H5N1, influenza such as avian flu virus, or severe acute respiratory syndrome, SARS virus, and swine flu, which is type A influenza, have caused serious, sometimes fatal pneumonia, even in otherwise also will affect the healthy people. So in pneumonia, the alveoli or the air-filled sacs in the lung responsible for absorbing oxygen are filled with pus and other fluid, making it difficult for the oxygen to reach to the blood. With little oxygen in the blood, your body cells cannot function properly. When the lungs become congested with the fluids, breathing becomes difficult. Signs of pneumonia really greatly depend on the cause and sufferer's underlying condition. Typical symptoms associated with pneumonia included cough, chest pain, fever, breathing difficulties, and a person with bacterial pneumonia usually have a sudden onset of symptoms such as high-grade fever, which is 38 degrees and above, chills, shortness of breath, chest pain, and a cough with a thick greenish or yellowish phlegm. For viral pneumonia, the symptoms usually start with a dry cough, fever, body and muscle pains. Subsequently, the person may become breathless and cough produces with whitish or clear phlegm. So treatment for pneumonia. Medication to treat pneumonia depends on the germs, which is either bacteria or virus that cause the infection. If the pneumonia is due to bacteria, antibiotics are usually given. If the pneumonia is caused by virus, antibiotic will not be effective. So a few viral pneumonia can be treated with antiviral medication. Besides antibiotics and antiviral medication, supportive treatment is also given, which includes medication to relieve coughing, fever, chest pain, and body aches. So for mild cases of viral pneumonia, a good bed rest, a balanced diet, and plenty of fluids may be necessary. For severe cases of pneumonia, hospitalization may be needed. And also the patient may acquire IV or intravenous antibiotics and oxygen. Okay, next please. So what is tuberculosis, or known as TB? TB is caused by certain germs, bacteria, known as Mycobacterium tuberculosis. It usually affects the lung, but other parts of the body can also be affected, such as the brain, lymph nodes, the kidneys, bones, and joints. So the risk progression to active TB is higher in the people which have underlying medical conditions such as HIV infection and diabetes, or who have weakened immune system such as due to drugs or sickness, who have also poor nutritional status and are substance abusers or drug addicts. TB typically spread by close contact and prolonged contact with infected individual, but not by contact with items or surfaces touched by person with TB. A person cannot get TB from sharing cups, eating utensils, food, or cigarettes. TB is not spread by shaking someone's hand, kissing or touching bed linens or toilet seats. So symptoms of TB TB disease depends on the area affected. Some of the symptoms of TB included a persistent cough which lasts 3 weeks or longer, low-grade fever, which is temperature below 38 degrees, night sweat, fatigue, weight loss, chest pain, coughing out blood or sputum. So as for now, I'll be passing over to Nurse Stella.
Thank you, Christina. So the next part of our talk will be talking about the 5-step approach. Do you remember the acronym that Christina said at the introduction? Yeah, so it's FIGHT, FIGHT. So the first one, F, is for frequent hand washing. which is very important in preventing the spread of the virus from the various different lung infections. And second, I for immunization, which is also the vaccination to help your body to build immunity to those infections. And then G is to go to the doctor. So you see a doctor if the symptoms are severe. And H, very important for home rest. And then lastly, T for tissues and masks. This is some of the hygiene ethics that we need to take note, which will be shared one by one later on. Okay, so first is the frequent hand washing. So frequent hand washing has been proven to actually prevent many diseases, and it's very important to wash your hand regularly and thoroughly. So you can also use an alcohol-based sanitizer if there is no hand washing facilities, like you cannot find a public toilet readily, to use soap and water. So how often should you wash your hands? Definitely you have to wash your hands before your meal and also after your meals, after you blow your nose or after coughing, before you prepare any food, definitely after using the toilet, and after you touch any shared surfaces like tabletops, doorknobs, or handrails. So in the case now that COVID-19 is the main focus, it spread through droplets like any other lung infections that Christina shared earlier. So like often we touch our face or nose, or when you sneeze, you may not remember to do a hand rub, and then you touch the tabletop, or you hold the doorknobs to open the door, or on the bus you grab hold to the grab bars on the handrails. Then these are the contact surfaces where bacteria can spread. So being very conscious to hand hygiene is very important. And now if you look at the right hand side of our screen, there are 8 steps of hand washing. So I'll go through the steps, and later on I will show a video step by step so you all can follow the video lah, okay? So first, these steps are a guide for you to make sure that you cover all areas of your hands when you do your hand wash. So as long as you cover all these areas, you are quite safe. Okay, so first is palm to palm, and then between your fingers with your fingers interlock. Oh, sorry. Okay, the back of your hands means you overlap one hand to the other hand, and then also slightly interlock. The base of the thumb, the back of fingers, your fingernails, and then your wrist, and lastly to rinse and wipe dry. Okay, so next I will show you the video. So as we watch the video, you can try to do all these steps together, okay?
Hand hygiene with soap and water. Wet hands with water. Amount of the product in a cupped hand and cover all surfaces. Rub palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palms with fingers interlocked. Rotational rubbing of right thumb clasped in left palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of left hand and right palm and vice versa. Wrap left hand over right wrist using rotational movements up to elbow and vice versa. Rinse with water. Dry thoroughly with paper towel. Use paper towel to turn off the tap or faucet.
Yeah, so this video, right, it's a typical way that the nurse would wash in the hospital. But then, of course, maybe at home, you may not need to wash through the elbow unless like you touch surfaces lah. Or you come back from home, from outdoor, you should wash as far as you can. Do not neglect the wrist and the other parts of your arms lah. Also, maybe like sometimes you might feel that the steps, step 2 and step 3, there is some variation. So if you go online, you look at other videos of hand washing, or you look at other guides of hand washing from different institutions, the basic steps should all be there. Only like maybe the step 2 and step 3, whether you interlace them together first or you do the back to back first, it's just that 2 might be a bit different. And the last step of using paper towels and then to like close it with the tap, all this is practices in hospital. But like I understand if you go outdoor or you go to a public hospital, public toilets, you may not always have hand towels with you or like your own handkerchief with you to wipe dry. But the most important thing is when you use your soap to do your hand wash, as long as you complete the 7 basic steps and then the final 8 step of rinsing it thoroughly, you should be quite safe, okay? Okay. So the next one, I for immunization. So immunization means your vaccination. So this is especially important for a certain group of people because when you're immunized, you are more immune or resistant to the type of infectious disease that you receive the vaccine from. So this actually helps your body immune system to protect you against those diseases. And this is especially important for elderly that are 65 years old and above, children that are less than 5 years old, and chronic patients with chronic medical conditions that compromise their immunity, means they have a weaker immunity. And these are people with diabetes, HIV infection, or they have heart disease, or they might be having going through some chemotherapy due to their maybe they have cancer or blood disorders, their immunity may be lower. So this group of people would need their yearly immunization. And not forgetting our healthcare workers who come in contact with different type of patients and people who like to travel overseas, they are always advised to do their yearly vaccination. So the annual flu vaccination is recommended to all people unless it's contraindicated or like certain condition that the doctor advised you not to take the injection. Otherwise, you are all recommended. Okay, so they can actually help to prevent all the different type of influenzas or pneumococcal viruses that Christina shared earlier. Okay, and for the flu vaccination, sometimes you may receive it more than once. So this is just a rough guideline of usual adult vaccination. Those below, like the MMR, the chickenpox, the Hep B, all this, you should already receive like when you were younger. Sometimes if immunity is low or patient who receive chemotherapy or had transplant, the doctor will advise whether you need to top up booster jab or restart the vaccination. But our main focus here is on lung diseases today. So the most important is the annual influenza. So annual influenza, you should do it at least once a year, but because flu viruses, they mutate and they change, they may have different strain at different season. So at some time, you will realize that at the second half of the year, the doctor might advise you to receive another dose of influenza vaccination. And the next one that the doctor will recommend for the elderly are the pneumococcal vaccination. Okay, and this pneumococcal actually can be paid through MediSave. This is the more expensive one. The elderly would know if you have done it before. Yes. So most of the vaccination are actually subsidized by the government if you are a Singapore citizen. And for the Pioneer generation and the Merdeka generation, usually have additional subsidy by the government. And you can also use the MediSave to co-pay. And then patients that is above 60 can also tap on their Flexi and MediSave. So all these advice are usually given at the polyclinic by the nurse or the counter when you are ready for payment. Okay, so anything that you are unsure of when you see the doctor or the nurses in the polyclinic, when they can advise you, okay? Next, G. So F-I-G, next one is go to the doctor. So now with the COVID-19 situation, need to emphasize, as you all know, that the clinics are all very packed, the hospitals are all very packed. So go to the doctor. It depends on your symptoms. If like you have very severe symptoms that cause you to cough very badly, you can't rest, you have shortness of breath, you have chest pain, definitely you will need to see a doctor. If your symptoms are very mild, be it, okay, let's say normal cold flu, your symptoms are very mild and you already previously had some medications at home and standby, you have Paranol for fever, you can observe. But if you need a medical certificate to prove that you cannot go to work, then you will need to see a doctor. As for those people who have symptoms and you did an ART and your ART shows that you are positive, so according to the MOH guidelines, if you are positive but you feel well, you should stay at home 72 hours. You don't need to see a doctor unless your symptoms are severe or if you are immunocompromised, means you have all the chronic problems, your immunity is not good and your symptoms are very bad, you should see a doctor and seek treatment, okay? Yeah. And like I say, home rest, H for home rest is very, very important. So if you are not well, you should rest at home and avoid crowded places like your school, your work, or the public places like shopping malls or wet markets for the elderly, so that you don't come in close contact with other people, be it the public or the family members, to avoid spreading the germs to them. So this is not only applicable during this period when there are a lot of COVID cases, this is also applied to usual cough and flu. Okay, so that's why we are doing this health talk. Okay, to emphasize that if you have all the runny nose or coughing, anything can spread. Okay, so we have to take care of yourself and rest, and so that we don't spread these germs to others. Okay. And the last one, T, F-I-G-H-T, T is for tissue and mask. So this is the basic hygiene ethic. Even without long time ago, when we don't need to wear masks every day, you are supposed to have tissue with you or your own handkerchief or whatever to cover your nose and mouth when you sneeze or cough. This is to prevent from spreading the droplets to the surrounding. Okay, and for now with COVID, right, usually I think you all will cough and sneeze in the mask already. So when your mask is soiled or wet, you should change your mask. Okay, and there's a proper way to change your mask, which I will show you. Okay, so if you look at the steps on the right hand side, when you wear your mask, you should hold on to the ear loops. Make sure it covers your mouth and your nose. Most of the masks are pleated, so when you wear them, you need to open up the pleat and then hook them to your ears. And there's a metal piece at the top. You're supposed to mold it along to the nose bridge, the shape of the nose bridge, so that to ensure that it's well fit. And if your mask is soiled, like after you sneeze, after you cough, or when you sweat a lot, you are supposed to change. So when you remove your mask, don't just hold from outside and just you have to hold on to the ear loops, remove it without touching the outside. Okay, and then find a rubbish bin and throw it away. don't attempt to throw it on the floor or like hang it around your wrist and you walk, or like squash, hold it in your hand till you find a rubbish bin, because it's not hygienic, because that thing is already dirty and soiled. So find a bin, faster throw away. Wash your hands if you have soap and water nearby. If not, take out your sanitizer, sanitize your hand, and then wear back a new mask. Okay, so I think I mentioned hand hygiene like multiple times. So do bring a sanitizer with you, like it's necessary at this period of time to protect you, especially for the elderly. Okay. Okay. So now we will proceed to, before you ask us questions, we will ask you some questions to see how much you understand from our from all the information that we shared earlier. So true or false, do you think that flu and cold are the same? You can unmute and answer, or type in the chat box, it's fine.
It's true.
Is flu and cold the same?
It's true.
Any other answers?
False.
False.
Yes, so flu and cold are not the same. So yeah, maybe it's still a bit confusing to some of them, because in Chinese, right, 我们就是讲感冒 right, cold, flu the same, but flu is actually from the word influenza, which Christina shared earlier. Influenza can be from influenza A, B, or C, and some are more severe than the other. That's why there is an influenza vaccination. And cold are usually caused by viruses like rhinovirus, which only can be detected if the doctor needs to do certain swabs, okay? And so they are caused by different viruses. Their severity is different. So just to reinforce, their symptoms are very similar. They can have sore throat, runny nose, cough, you feel tired. But flu usually are more severe. The flu viruses are more severe than the cold virus, okay? And usually they might have higher fever, have body aches. So they might display the same symptoms, but depending on what virus causes it, they can categorize into either flu or cold, and they're actually from different things, okay? Different. Okay, the next one, true or false? Oops. Okay, the 5-step approach that I shared earlier, FIGHT, is H representing hand wash? Does the letter H represent hand wash?
No. False.
False. So what is it? Can you remember?
Home.
Home rest. Yes, home rest. So hand washing is also very important, but the acronym that I shared earlier, to fight viruses, you need to rest. So home rest, especially I think you heard a lot about COVID-19 and what to do if you're positive. So home rest is very important. You need to be well enough to go back out to the public, okay? Okay, so next, Christina will carry on. Keith, you are muted.
Thank you. So for the third true or false question, are there 8 steps of hand washing? Can unmute to answer.
True.
Oh, yes.
Yeah, well done. Yeah, correct. So as we refer to the video, there are 8 steps of hand washing, which at least lasted about 20 seconds. Right, well done. So lastly, the true or false question, I am recommended to go for flu vaccination annually. Is it true or false?
True.
True.
Okay, good job. Yeah, the answer is true. So as earlier Stella sharing about the immunization, flu viruses are constantly evolving and your immunity may decline over time. So annual vaccination is highly recommended to give you and your loved one the best protection. Right, well done. So now we proceed to see a short video for hand washing.
Okay, so just now the hand washing video we showed is like the very proper teach you step by step how to wash. Okay, this one I don't know whether you all watched before. Maybe when you all watch YouTube or you watch whatever, you got some advertisement. I like this video a lot. It's very interesting. I'm going to share that video. Okay, so maybe as you all watch, you all can dance along with the video or try to do the steps. Maybe okay. Okay, hold on. Let me see if I can. Where is it? Can you all see? Kids can see?
Okay, yeah, they can see.
Is it full screen already?
Yes, full screen.
Okay, enjoy.
right.
Yo, man. Today I'm going to teach you how to wash your hands. It's easy. Just 8 steps for at least 20 seconds. You guys ready? Step 1, palm to palm. Step 2, between your fingers. Step 3, back up your hands. Step 4, base of thumb. Step 5, back of fingers. Step 6, fingernails. Step 7, remember the wrist. Step 8, rinse and wipe it dry. 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 Rinse and rinse and rinse and rinse and rinse and wipe it dry. 8 steps for at least 20 seconds. So easy. Rinse and wipe it dry. 8 steps for at least 20 seconds. So easy. Your turn.
Yeah, okay. Was that interesting? Something very different from our usual, something very different. This is actually by the,
Packaging with soap and
hold
water.
on, sorry. Okay, so this hand washing video is by the Health Promotion Board which I think is very catchy and easy to remember. So you can actually go YouTube and show it to your other friends. Do you know that like in school, like preschool, kindergarten, they also teach the kids these steps of hand washing. Yeah, so I hope that y'all can also try to practice on it and have this habit, yes, of doing all the steps so that it covers all areas of your hands. Okay. Do y'all need us to do it with y'all? Do y'all know how to do?
It would be nice that everybody can on the camera and do together.
Yeah, you want to on the video and do the 7 steps? Oh no, 8 steps. Sorry, I'm stuck with 7 like, since the many years back.
Yeah, I think it would be nice, everyone. Maybe Stella, you can stop the share screen, then we get everyone to on the cameras for those who are actually comfortable, and then maybe we can just play the video at the background. Then we can listen to the steps that we all do together.
Okay, give me a moment. Y'all get ready.
Then we can help to spot check who do wrongly. Can help to remind one another on our 8 steps.
First hand wash guide, okay, very easily found.
Wow, I see a lot of people ready already. Your hand like doing.
You're very ready. Okay.
Today I'm going to teach you how to wash your hands. It's easy. Just 8 steps for at least 20 seconds.
20 seconds.
Step 1, palm to palm. Step 2, between your fingers. Step 3, back up your hands. Step 4, base of thumb. Step 5, back of fingers. Step 6, fingernails. Step 7.
Yeah, very fast.
Rinse and wipe it dry. 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 Rinse and rinse and rinse and rinse and rinse and wipe it dry. 8 steps for at least 20 seconds. So easy.
Can keep up. I think cannot keep up, right? I cannot keep up as well.
Very fast.
Too fast.
Your turn.
Yeah, so you need us to tell you the step by step again. Christina, you want to show step by step? in case they cannot keep up with the video.
I think back to the slides, the 8 steps.
I would like to actually shout out maybe one person, any audience would like to share the first step that we all follow together as well. It will be fun also.
Yeah, anybody want, any of the elderly want to demonstrate? Show us how you wash your hands.
Me?
Yes, we have someone, Sarah. iPhone. I don't know your
Oh,
name, sorry,
hello,
but
Auntie. Auntie, 你要示范吗? You want to try?
Yeah.
Okay, wow, palm to palm. And then?
Finger.
Between the fingers.
Fingers interlace.
Yeah,
And
okay. Then after that, soap here. Soap here.
then?
And then here.
Oh.
And then like this. Right.
Then rinse. Got 8 steps or not?
God.
Got 1 step like that, never do. This one.
What?
Oh. This one, maybe
Oh, yeah,
hard
yeah,
to
forgot.
visualize.
After
Yes,
this.
just like that, Dato, balik like that. Hold like that, then scrub. Yeah, this one I think hard to visualize for most people. Must practice, then can. So must switch side, okay?
After this.
Then this. Then this.
This.
Yes. Then wash.
Like this. Interlock. So. Got 8 steps.
Yeah, good job.
This part I forgot.
Thank you for your participation. Very good.
Drop down with 4 hours.
Who is that speaking? Okay. So where we get from our information. Keith, you want to continue?
Yeah. So any Q&A, any question to ask?
I ask, you say if people have severe exercises, then they feel exhausted and tiredness, then they get into a cough, cold. What it caused by what? Virus. Excessive exercise that causes cough and cold.
Causes cough, cold.
Okay, so usually, right, your cold symptoms, like we shared earlier, they are caused by viruses or bacteria. They usually have some viruses or bacteria. Like exercise don't usually would cause. Okay, the only time if exercise can cause cough or shortness of breath is when you have asthma. Okay. Yeah, so if you are someone with asthma, when you have an asthma attack, you will start to feel breathless, you have cough, you have wheezing if you exercise, if you never take your inhalers. But if you're talking about the usual lung infection that we're talking about today, the influenza, the cold and cough, so they have different kind of viruses and bacteria that can cause those symptoms. Yeah, so if you want to find out what is it, usually the doctor will need to take swabs and test. Otherwise, they will give you medicines to help you relieve the cough and your phlegm or your runny nose. Then they will ask you to rest at home. Okay, the exact cause there need to be some tests to be done. If you're talking about just exercise, then we need to know what other medication or medical background they have, if whether they have asthma or not. Okay.
Would you mind show the previous slide about the references? Thank you.
So health.sg has a lot of information. MOH also have a lot of information, especially COVID related, what you need to do. So you can go online and check. Okay.
Hello, may I ask you? Hello.
Yes.
May I ask you why I am always panting? Is it too weak my body?
Hi, Miss Christina, maybe you can share with the nurse more about when you say you are breathless. Are you wearing mask?
No, not breathless. Just if I move, or maybe I'm too anxious, always move very fast. So I tend. So I wonder, is it I'm too weak?
这个是那个
Christina.
Yes.
Christina. Yeah. So there can be many reasons for your panting. It can be if you have, like I shared, if you have lung issues like asthma, COPD, or you are not well that day, you have flu or cold, or you are exercising you can pant, or if you have some psychological issues, like you tend to get panic and all that. So over the health talk like that you never seek usual consultation with the doctor, we wouldn't know exactly what's the cause of a panting. When you say your body is weak, it's also very vague. Weak in what ways? There can be many ways as well. If you haven't seen a doctor and you are very worried about your panting, that is a very disrupt your daily life, makes you cannot continue what you are doing, it's making you even more anxious, then you should see a doctor so that they can do more checkup on you.
I'm okay. Just I wonder how come maybe I move very fast.
Probably. It's hard to say over the video call right now, as in through this. Yeah, because some symptoms are very similar across many different conditions. So most importantly is if you think that the breathlessness or the panting didn't resolve even at rest, and you're very worried about your health, that is really affecting you like you cannot continue what you need to do daily, your basic showering, your basic walking, you cannot do all this thing at all, then you should go to a doctor and get proper diagnosis. Okay?
Actually, okay. Everything just fine. Just I'll come always panting.
This is my advice for you to take note. Okay?
I think I'm quite healthy. I like exercise.
Okay, good.
Thank you.
No problem.
I like to say if she's healthy, she shouldn't be panting, isn't it?
Hi, thank you, Stella, for sharing and some feedback from the participants. I believe everybody will know your health the best, and like what Miss Stella has advised. If you feel that this issues persist for a very long while, then perhaps it's good to do a checkup. However, if you know you have been to the checkup and the doctor already say you're fine, but you're just wondering the breathlessness of all, then and doctor already say it's okay, then you monitor for yourself a bit before if you think that it has worsened, then we go and proceed to see a doctor again. Like we all say, we know our body the best, and maybe your family and friends can help you to take note of it as well. Because through this this health talk, it's very hard for us to determine how serious is our case or is it or not, because we do not know any of you very well. It's only based on the statement that you have made, and we don't want to misdiagnose or misinterpret what anyone was trying to say as well lah. So, but I understand everybody's kindness to help one another through this health talk as well, by contributing and sharing a lot as well too. But thank you, Madam Chan and Madam Au for the sharing, and also just now the Madam iPhone, I shall call you Madam iPhone for sharing on your 8 steps for hand hygiene. Also, would like to check if you are using alcohol rub, right, our hand sanitizer, do you think we should follow the 8 steps as well?
No.
No. So if we use alcohol rub, then how many steps do you think we should be doing? Or if only the pump to pump will be enough? I don't want to make a guess. Will it be the same as hand washing? We must wash palm to palm, back to back, finger to fingers and all when we are using hand sanitizer?
No.
No. Okay. So Miss Sarah or Miss
Yes,
Christina?
the answer is yes. You need
Yes.
to
the same
use.
step.
Yes. So if you use just the hand rub, of course, no rinsing lah. Don't have the last step. Okay, no rinsing and drying. If you are using hand sanitizer, it will dry up on its own by the time you reach the 7th step. Okay. Yeah. So this is the same practice throughout in the hospital, or it's all advised to you. The 7th step is the most basic the methods for you to clean your hands thoroughly. So even if you use a sanitizer when you're out without water and soap, you follow the 7 steps. Okay, the 8th step is the rinsing and drying. Okay,
But the 8th step, the hand rub one, by the time you put the drop, the hand already dry. The hand, how to follow the 7th step?
Yeah, so you need to
Put
have
a lot.
sufficient, not needless a lot. I think like a 20-cent coin amount is more than enough. And then yes, you should do it fast, like the video fast. So it should only
20
last
seconds.
about, if you do slow, should be also about 30 seconds lah. If you practice enough, 20 to 30 seconds, and then it's just nice. If you feel not enough, you can do second time.
But the public see you will look very funny.
Oh no, I maybe because we are so used to it lah. It's not funny lah. It's to protect yourself.
But you see, I see all the children in the school, they do properly, but at home they anyhow how to. There's no discipline.
Maybe some parents also don't know about this step, so maybe you should spread this information to your relatives. You teach them, tell them that this is important. So once you start practicing, it becomes a habit. You will naturally do it.
Yes, thank you, Sarah, for sharing and the raising the awareness from Madam Ivo was sharing that a lot of people who doesn't know that. So for today's health talk, we actually learned about the 8 steps. If you are using hand wash with hand soap, then maybe if we are using hand sanitizer, it's probably just the 7 steps. And also the meaning of FIGHT. So something that you can share with your grandchildren if you have, or your friends and family members, so that they can also take away this learning as well, and we can learn to actually keep ourselves protected and also our loved ones. So sometimes Madam Ivo mentioned that I do like that, everybody think I'm a bit conscious and all, but it's like what Sarah has shared, you protect yourself is the best, but don't try to rub too long, like 5 minutes you keep doing like that. So it's like a good 30 seconds to finish all the 7 steps will be good enough, because I believe all of us when we are outside, like for myself, I also do the 7 steps when I use hand sanitizer outside, and so far nobody haven't judged me yet. So haven't laughed at me at all. So I think it's fine as well, as long as we must learn how to protect one another. So I don't know, are there any questions regarding this topic you would like to chat with Miss Sarah or Miss Christina? Okay, maybe you'll wait for a while more. You can, if you're shy, you can type in the chat box as well. And then, yes. So for next week, you all can think about any questions, but for next week, we will still be sharing about this same topic, however, in Mandarin version. So for those who would like to join us in the Mandarin version, then you can join us next week as well. Next week will be the 21st March at 2 p.m. also, but you in Mandarin version.
Last question. Is it better use face mask or disposable mask? The cloth one or the face mask?
Okay, so our face mask has the filter layer, right? Usually our face masks are at least 3-ply, which include the filter in the center. So the filter is like to help us to filter out the things that we don't want, so you can get close to us. If you use the cloth mask, right? The cloth masks usually are like double cloth, and it can block droplets, but whether it can block other viruses, that we are not sure. Some places do sell the filter insert to insert into your cloth usable face mask. So I know of people who insert the filter themselves if they are using the reusable cloth face mask. But for the safety, I mean for elderly, maybe it's safer just to use this surgical mask which already have filter. Okay.
Thank you.
I believe regardless of surgical mask or cloth mask, for cloth mask, do wash it every day. And for surgical mask, once used already, you reach home, try to throw it away and don't keep until next day can be used, don't reuse again. I understand some of us will feel that, wow, disposable mask very expensive. Then we need to keep until tomorrow, not dirty, keep until tomorrow, but try to throw it and discard on a daily basis.
The face mask, how long, for how many hours can be used?
Sarah, Christina, you like to...
You mean the surgical face mask? Surgical face mask usually
4 to 6.
For hospital, yes, we change after 4 hours lah. We don't wear too long, like 8 or 10 hours.
Unless if it's soaked, then we can change a new one. Or moist.
For the cloth one, can use longer?
If the cloth one is wet, you also should change. Okay.
So the duration is the same?
I don't think there's a difference because since there is no filter. You get what I mean? Yeah. But I believe now everybody, they usually just wear one mask throughout the day lah. Be it cloth or surgical. But if you're talking about in the hospital setting, what we advise, I will tell you the disposable mask, just wear between 4 to 6, like what Christina say. But I think maybe like for those who are working, the half day in the morning they will wear one, lunchtime they will throw, and then after lunch they will wear a new one. So it basically fits in the 4 to 6 hours advice. But if it's a cloth one, you are wearing it the whole day, I don't think MOH has any criteria on that lah. They will still ask you to wash daily lah. Okay.
Excuse me, I want to share. Some people go and spray the sanitizer on the face mask. Is wrong.
It's spray sanitizer to clean the mask or to spray before they wear?
Spray before they wear. I think it's wrong. Right?
Yeah, disposable mask itself, when you first use it, if you keep properly, it should be clean already, so you don't have to spray any hand sanitizer on your face mask before you wear it. Yeah.
Thank you.
Correct me if I'm wrong, Stella. Christina.
Yeah, you don't need to spray lah. Even if you are planning to reuse, you're not supposed to reuse. So if you think that, if I want to reuse, later I spray then use again, but not advisable lah. You don't need to spray. If it's soiled, dirty, used, you want to change new one, should throw away and just use a new one.
Yes.
Sorry, if you have a chat
hello,
with me,
Hello?
you mentioned that there's a lot of slide that Mimi Christina talked but not shown on the screen. What type of slides are you talking about?
I know she can't mention. She mentioned a lot after she showed the slide. Yeah, what type and all that. But I see that was not projected on the screen. No, you know what I mean. Because we all are seniors, laymen. We want to know more. Like what are the various types. Like before she taught on the signs and symptoms. Then she taught on what are the germs and or whatever. Like for instance, she taught a lot. Then after the next topic, there are a lot of slides, but I noticed was not shown on the screen.
I understand. When our nurses tried to prepare the slides, they will try to put more visual and less words for all. So actually, the main points only on the slide, so that it's actually easy for everyone to capture. As compared to if a slide full of words, some of you all might find it very hard to actually absorb in as well. So when we are doing slides, it's actually more visual and less words. So when Christina shares, she will actually share more. But thank you for your feedback. We noted that you all will prefer to have more information on the slides. Is it?
Yes, so that we all will, at least when we refer back, we after the talk, we tend to forget, sometimes we want to refer back. So what are the types and what that,
And then you all don't have enough time to actually jot down all the. I understand. Thank you. But actually, if what Radima's Gary has mentioned, they actually have a recording on their Facebook and also on YouTube page. So if you need to actually recap back, we can always relook at the sharing on the recorded video also, so that you can have a better understanding as well for the topic.
No, but the talk sometimes is a bit fast for us to slowly digest. Whereas with the wording on you see a picture tells 1,000 words, right? So with the print on, sometimes you can absorb more. You know what I'm trying to say?
Okay, and noted, Madam Ho, we will actually take in the feedback and we will see how we can actually fine-tune our slide to actually meet everybody's learning needs also. But then it's a very good feedback for us also lah. We will take in to actually look back to the slides and again to see how we can actually improve on it as well.
Okay, thank you.
Thank you.
Hello, may I ask you, is there expiry date for the mask?
You check your box. You check your mask box have or not?
Some have, some don't have. So I wonder whether it's really must use for a certain time only.
If have, you follow.
Okay.
If don't have, but I don't have a specific date for you, because I also don't know when the mask is being produced. And how they do it for different suppliers. So I don't have a definite answer, but if the box has a expiry date for you, then it's safer to use before the expiry date. Okay.
Okay, thank you.
I noticed because I was attending to the washing of corridor. I just saw that you're repeating these slides. What about what are the slides before pneumonia or TB? Or this the one? Okay, don't mind I take because I'm using phone to screenshot. So many more.
You can refer back to the recording and then you can rewatch 100 times. It's also fine.
Sorry, will you mind to share the Facebook link again so that the residents can take note of the Facebook page as well? Then they can actually know what
it's Radima's Facebook, is it?
Yes, the Radima's Facebook.
Because I overlooked when I read my messages, then I realized it's already past 2:11, 2:10, then I came in. So missed a lot already. Is it?
Yes, a small bit
Because
only.
I'm using phone, I can screenshot. Okay, this is the first one, is it?
Yes.
Okay. I screenshot faster because using phone to screenshot faster than taking taking pictures from the laptop. Okay, finish already. So what's that? Okay. Hygiene.
Thank you, Gary. I think Radima's team has also shared on the YouTube playlist. So that's the playlist where there's all our past Health Talk series. So you can take a look as well to actually cover other topics that you have actually missed previously that our nurses have shared.
So next Monday is the Mandarin, is it?
Yes, that's right. It's our Mandarin version for next Monday. And Gary also shared the form.gov.sg, the sign up for our Health Talk. So if you would like to receive SMS reminder from us, to actually sign yourself up, then we will send you an SMS with Zoom link as well. So okay,
thank you.
So in view of time, it's already 3:05. We shall not hold anyone's time any longer. Once again, thank you, Miss Stella, Miss Christina for the sharing, and thank you everyone for the participation. I do enjoy the hand washing series and watch everybody learn together. So it's very fun to watch all of you do it all together and learn together. So thank you everyone for your feedback, and we will see you next Monday for those who are joining us for the Mandarin version. Bye-bye.
All right. Thank you, everyone.
Very much. Bye-bye.
Bye-bye. Bye-bye. Thank you. Thank you.
Wish everyone in good health. God bless you.
You too.
Yes.
Yeah, you too.
You too.
Okay, thank you. Thank you
Thank
very
you.
much. Thank you. Bye-bye.
Bye-bye.
Bye.
Bye.
Yeah, see you. See you.
Thank
Yeah,
you.
thank you. Yeah.